And this is my final project, The Path to Becoming a Physician's Assistant. The career choice I've picked is the PA, a physician's assistant. The scope of practice of a PA is essentially they can do anything a doctor can, really. They can diagnose illnesses, they can create and handle treatment plans, they can prescribe medications, and in some cases, they can even perform surgery. The main difference is that a physician's assistant has to work under a doctor's supervision. But in most cases, the physician's assistant does not really communicate with the doctor. There's little to no communication in most cases. This is a result to the fact that the PA has to make these decisions on the spot, and they have to be correct. They have to be right about it because it could be the patient's life on the line or an extremely significant life choice that is about to be changed due to the PA. Another very important aspect of being a PA is you have to be very social. You have to communicate with a lot of people constantly, day to day, including, but not limited to, the patient, the family members, doctors, nurses, and other medical personnel in order to deliver the best treatment possible for the patient. Before someone becomes a PA, there are a few steps that one must take in order to achieve the title PA. In order to become a PA, one must first complete a bachelor's degree of any sort. Although, if it is a health or science based bachelor's degree, it would be more beneficial for the student because many of these classes would overlap with the prerequisites. On top of that, the students must have a certain GPA, science GPA, and GRE scores, along with a certain amount of hours of shadowing, patient contact hours, and volunteering. Most schools also require about 3 letters of recommendation, and depending on the school, there are certain amounts of prereqs, including organic chemistry, biochem, physics, classes like science-based classes like that. Once all this info is put into CASPA, which is the common app for PA schools, some schools may schedule you for an interview. If they like you and you like them, you'll be accepted into a PA school. Now, the student must complete a master's in physician's assistant from any accredited university and complete the 2 year program. The first year would be didactic, which is mainly books, studying, class, lectures, and the second year would be clinical, where you're working in the field, performing surgery. Yeah. Um, after this, after all this is completed, the student must pass the PANCE exam, which is the exam that will give you your certification to become a full fledged PA. Once you pass that exam, you are officially a physician's assistant. A PA can work in any state or any territory in the US. The title PA doesn't really exist in other countries, so you can only be a PA in the United States. A PA can work either part time or full time, but most of the times PAs work full time, about 40 hours a week. The working conditions for a PA are a little rough. A PA is in charge of making huge life choices and changes for the patient. And sometimes these decisions have to be split second decisions, in cases like surgery, for example. If a patient is on the surgical table and there's a choice between saving the patient's leg or amputating it and saving their life, the PA is in charge of that decision, and that decision will affect that patient for the rest of their lives. So, as you can see, there could be certain situations for a PA that would put them under extreme pressure. As for the logistics of working as a PA, the PA field is a rapidly growing career choice. It's expected to grow about 37% within the next decade, 2016 to 2026, with an expected growth of about 100,000 jobs. Now, looking at salaries, a starting PA fresh out of PA school would make about 72,000 on the low end of the spectrum and 109,000 on the high end. But after you get some experience, a PA is looking at about an average salary of 108,000, but in some cases it can go as high as 151,000. A PA must continue their education even after they graduate PA school. They have to continue their education because of the rapid evolution of medicine. A PA has to be on top of their game and be up to date on the latest procedures, techniques, and laws. One way a PA can continue their higher education is by joining a professional association. I found two that I personally liked, one being the American Academy of Physicians Assistant, or the AAPA, and the National Commission on Certification of Physician Assistant, or the NCCPA. Most of the time, these associations offer ways to continue the PA's higher education through their websites. Here you will see my timeline from now until the next 5 years in my career path for a physician assistant. First off, I have to get a job and accumulate patient contact hours and finish my bachelor's degree. After that, I'm taking a year and a half off, in order to take the GRE, study for it, and rack up on patient contact hours. After that, I'll be getting my letters of recommendation, interviews, and eventually I'll be starting my PA school around 2021. I'll complete my 2 years of PA school, the didactic and clinical year, and then around 2023, I will be graduating from PA school and I should be applying for jobs the next month. Right after I apply for jobs, I'll be taking the pants, and hopefully, if I pass it, I should be hired as soon as I can. And the PA career is a really intense and stressful job, but I personally love it. I find it super interesting, and this is what I want to do for the rest of my life. So, I'm ready to take the steps to do it. I have to complete my bachelor's degree, I have to get the master's in physician assistant, and I have to pass the pants. I have a timeline set, and I know what the outcome is as a PA in terms of salary and job outlook, considering it's so great. And I know the stress that comes with it, and I'm ready to take it on.